Hi everyone, this is Dr. Marler, and I am happy to welcome you to the fall semester of your junior year, and specifically to Pharmacology I. As you'll see here, this is the As You Learn site. This is for section 101, and we have section 102, which when I talk today about the requirements and the processes that we'll be going through this semester, they're going to be identical for both courses. The dates and some testing will change at that point later on, and I'll talk about that some. So this is going to be where we're going to start. So when we're looking at this first welcome information here, this is a really nice and great area for you to look at a lot of the information that we have here. So announcements, this is a section where I will make announcements for your class specifically. Sometimes there may be some changes or something with each of the sections, depending upon kind of how class goes and questions and responses and that sort of thing. And I will make responses in this or announcements in this section here for you. The My Materials tab will take us to the textbook that is set up for this course. As you can see here, it is Laney's Pharmacology for Nursing Care, and this is an ebook for you. And you can access this book and with the Read Now, and it will give you, you'll be able to go read whatever parts of the book that I have assigned. So it's going to be really important for you to read all of the chapters that I've assigned. Certainly, I'm spending the most amount of time on those areas that I specifically want to focus on, but make sure you read at the end of the chapter. There's going to be a discussion about nursing care, nursing impact. Those are important pieces and areas of information for you to focus on as well. Some of your test questions are going to come from those areas in the chapters. So if you only have a few minutes to focus on the book, try to read what I've assigned and then look at those nursing practice implications that are going to be key for us this semester, because there's no way that we can cover absolutely everything in this book. But we do have 2 semesters. We'll try to do the best we can. I think you'll learn a lot this semester, and we'll cover a lot of information. This tab on the right side is my contact information, and my office is in 512C Leon Levine. Here's my mobile, there's my office number, and you are welcome to reach out to me primarily. Email is going to be the fastest way that I'm going to get your information and respond back to you. I try to respond within 24 hours. If it's the weekend, it may take a little longer. But if there's an emergency that may come up for you this semester, please feel free to send me a text, but make sure you indicate which section you're in and that you're in the pharmacology class. Here's some other App State resources for you as well there. So course introduction. This is an area where we're going to start off with, and we're going to look at our course syllabus. So this is a 2-semester course, and we're going to be, actually this is the first semester that we've had this course in 2 different sections. So we have section 101 on Tuesdays from 1 to 2:50, and sections 102 on Thursdays from 1 to 2:50. Again, my office hours are here, and we can set up any kind of office hours or any kind of session that you may want to attend a meeting with me on Monday, Wednesdays, or Fridays, and we can do that remotely. And we can definitely come up with a time that would work for us both. Here's the course objectives. I would like for you to read through those and make sure you understand what we're really going to focus on this semester. Why is pharmacology important? Pharmacology is one of those basic foundational courses that nurses are going to keep coming back to for the rest of your career. In order to take care of patients, we have to understand our drugs. We have to understand what they're for. We have to understand how to safely administer them and when to safely say, you know what, now is not the right time that we need to give this medication. We're going to do some face-to-face. We're not going to have very much online stuff other than some pre-recorded videos and things like that that you're going to watch. For the most part, this is a synchronous course. There is one day that I'll point out to Section 101 a little later that I'll be out of the state for a conference, and we will not have class that day in person, but there will be some online activities for you. So this is, again, a 2-hour course. You really need to expect to spend at least 4 to 6 hours outside of class per week really working on this information, this content. This content is going to be directly relational to your clinical work. For your fundamentals clinical, you're going to be administering medications. You're going to be learning about how to safely take care of patients. And pharmacology, again, is an exceedingly important topic to focus on. Other information that is in all syllabi that is important for you to focus on as well. And any kind of information that you may need is there in the syllabus. So course evaluation, how are we going to evaluate this course? We're going to have 4 exams. Each of them are worth 15% of your grade. We have a final exam that's 25%, and then we have class activities that is worth 15%. Those class activities, 15% is a huge portion of your grade. And in order to participate in those class activities, you have to be there. Certainly, I understand that some things come up with courses and the times, but if you're going to be out, you need to let me know ahead of time so that if there is important information, there's going to be important information obviously talked about each day, but make sure that you don't fall behind, because if you fall behind in this course, it's going to be hard to catch up. So again, class activities, you have to be there to get the credit for it. And this is the grading scale that you've already seen. And any grade below a 77 does not satisfy the BSN requirements, and we'll have to do some work on that. So we have a developmental plan. We have Miss Bonnie Koski, who is our academic success coach. Some of you may have already run across her in this past summer, but if you make less than a 77 on a paper, an exam, or something like that, really reach out to Miss Koski, and I will sometimes also be referring people to her. She is a tremendous resource that we will be able to utilize this semester, and she really will be able to help us really fill in the gaps where some things may be missing in the course. Testing is going to be general information, testing security. We're going to use in-class testing with Respondus. And that's it for the syllabi. So, course outline. So the course outline, this is for section 101. Make sure when you're thinking about what is happening in terms of testing that you're making sure that you're looking at the correct course schedule, because some of you may have friends in the different course section and don't confuse the dates and things that are due. With this course schedule, you're going to find all the information that we're going to focus on the first day of class, August 19th for section 101, but then also August 21 for section 102. Again, section 102. So make sure you're focusing on the section that you're in. Okay, and then we'll go through each of the days with focusing on certain topics during that week. And then by week number 4, we're having our first exam. So I encourage you to look through this schedule for the remainder of the semester and make some indications of when the testing dates are, because once we get in the middle of the semester, some of that days will be changed up from one section to the other in terms of not having the exam exactly back to back. So final exam, going to be determined later on. Not sure when that's going to be yet, but we have also Thanksgiving break in there, and then exam 4. So again, this is another area for your materials. Respondus testing instructions. If you did not if you have not downloaded the Respondus onto your computer, it's a web lock browser basically, where you can't open up any other pages once you've started this lockdown browser for the testing. If you have questions that may benefit the whole class, may benefit your colleagues, please put that question here so that I can respond to that. Because if you have the question, most likely somebody else in your class is going to have the same question as well, or need some more clarifying information. There's also student lounge for you to ask questions or communicate with your colleagues there as well. Well, there's 2 Respondus testing instructions. I'll take that one out of there. So course resources for this semester. We have student support links and technologies, and technology link as going to be important for you to note as well. Medication template. This is our medication template that we're going to be using this semester, and there are various assignments throughout the semester that does count toward that 15% of your grade. But I'm going to be asking you the first day of our class, I'm going to be asking you to turn some medication information in for me. So obviously name, med, class, history, or category class is going to be important. And then, we're going to talk about the pharmacologic actions, what is the therapeutic use, complications, etc. with some of those medications. So I have the first day of class there as an assignment due. So make sure you listen to one of the videos that describes what you have to do for that. Now, again, this is section 101. So on August 19th, we're going to talk about some introduction to basic principles of pharm. Okay, so this gives you a list of information here that you need to focus on for our first day. There's an introduction to pharmacology, some terms to consider. This is a recording here, but I've also uploaded the same recording into YouTube with some closed captions if you prefer to read or get the transcript from that as well. I put both options in there for you so that you don't have to go to YouTube if you would prefer just to stay in the course cell. There's also the PowerPoint here for you, and then there's Introduction to Pharmacology Terms and Notes that flows right along with this this lecture and the talk and the recorded video. So it asks you some questions and helps you take notes directly onto this page. So you can print this information out, start taking your notes, start organizing yourself, because with pharmacology, again, it is the first time many of you have seen any of these drugs or thought about how to approach care of a patient with these medications. So it helps us kind of break down things a little more succinctly for you. There's another video the first week that's what do I need to know about medication. Again, this is more of a kind of a directed approach towards certain medication classes right there. And again, closed caption, and then there's the PowerPoint available here. This is the 5 medication template upload box. Okay, and then this is the lecture for our first day with some in-class notes. We're going to be hitting the ground running, so coming into class, having listened to these videos, having a basic understanding of what some terms are and how those apply to our patients is going to be very important. Week 2, again, the same sort of thing. There's an example of here of what you're going to do. There's an exam review guide already posted in for the first exam, plus there's an independent work on a unit 1 quiz that I'll talk about in just a minute. And then additionally, more information here for you, and then the same thing with pharmacodynamics, same sort of information there. On week 4, we're going to have our first exam. There's the exam review guide there for you. And then there's a unit 1 quiz. This is due the day of your exam at noon, and 9/9 for section 101 1 and 911 for Section 102. But this is a quiz that you can work on throughout the semester. This is going to help you in terms of thinking about how I ask questions and what are the important concepts that you need to be comfortable with. I don't have the rest of the course open yet because I'm still working on that, but there will be, the next section we'll be talking about is anti-infectives, and then we're going to cover as your course calendar described, different topics as we progress throughout the semester. So organization is important for this course, making sure that you don't get behind. If there are questions that come up early on, please come to my office. Please reach out to me so that you can get the information that you need early on, and that we can make sure that you start off the course with a beginning successful time. Again, I'm glad you're here. Pharmacology is, I think, is a great course, and it's something that you're going to be dealing with and managing and talking about with your patients for the rest of your careers. So again, welcome, and I will see Section 101 on Tuesday, the 19th, and then Section 102 on Thursday, the 21st. So again, you have my contact information. Please make sure you've watched the videos before you come to class that first day, and make sure you started your medication templates. And I will, in one of the lectures, I've assigned which drugs I'd like for you to look up and detail some information on. So please let me know again if you have questions, and I look forward to working with you this semester.